Perfect. Well, hi everyone, and welcome to the Community Engagement Series. My name is Priscilla Medeiros. I'm the Knowledge Mobilization and Community Engagement Specialist at the Edwin S.H. Leong Center for Healthy Children and your moderator for today's session. I am incredibly excited to introduce our speakers for today's webinar. We're joined by Dr. Shazeen Suleman, who's a clinical associate professor in General Pediatrics at Stanford University, as well as a co-director of community engagement with the Office of Child Health Equity. She's also a global health faculty fellow and has a courtesy appointment at the University of Toronto. She's founded the Compass Clinic in Ontario for newcomer children with special healthcare needs and leads research on health disparities for migrant children supported by CIHR grants. She's also recognized as an expert in migrant child health and holds key leadership roles with the American Academy of Pediatrics and the Canadian Pediatric Society. She's also co-founded the Music Box Children's Charity and maintains strong ties with refugee support agencies, as well as policymakers across North America. We're also joined by Richa, who's a proud mother of two amazing kids, a teenage son with special needs, as well as a 6-year-old daughter. She works as a recruitment consultant at Accenture Canada, and before joining Accenture, Richa spent over a year as an HR specialist at UPS Canada, where her first kind of role after relocating from Nepal was there. She holds degrees in electronics and communication engineering, as well as an MBA in human resources. And in Nepal, Richa worked for over 9 years in human resources at a commercial bank. And the decision to move to Canada was motivated by the country's welcoming culture, its high quality of life, as well as growth opportunity. Richa and her family certainly have embraced the challenge of starting anew and are grateful to call Canada home. So their presentation today will focus really on the importance of and best practices for including newcomer families in research with touch points of their own experiences and work that they're involved with. So welcome to Shazeen and Richa for joining us today, and I'll now pass it off to you for your presentation.
Thank you so much, Priscilla, and hello to everyone. We're both really, I know I speak for Richa and myself, we've been talking about this for a little while. We're both really excited to be here. And you know, as we start, I'm currently in Toronto, which is under the Dish with One Spoon Treaty and is the traditional territory of the Haudenosaunee, the Wendat, the Huron, and is currently, most recently, for the Mississaugas of the New Credit. And I think it's so important, even though we're talking about people who have newly arrived in what is now called Canada, we're only able to care for those people who, many of whom have been displaced from their ancestral territories, because the people whose land we're on have been displaced from their land. And so there's like an intimate connection between caring for immigrant health and addressing and supporting Indigenous sovereignty, which guides much of our work today. So we're hoping today, even though Priscilla tells you we're experts, we're going to tell you we're experts in our lived experience, but so are all of you. And we just want to share with you our learnings and our journey, which is thinking about how are there barriers to including people in research, especially when they've newly come to Canada as families with children? What makes it difficult and what makes it hard? And some strategies that have been helpful at including families in research in an equitable way, including in advisory board roles and what that could look like. And I'm most excited for you to hear from one of our parent co-researchers directly, who's Richa, about a study we've been working on together. So I want to tell you a little bit about my story too, because people often ask me, how did I even get into this work to begin with? And my family came to Canada as refugees from Uganda in the 70s, before I was born. So like many of the patients and families that I see in my clinic, the parents and I often joke that I'm just like their kids who might have been born in Canada, whose parents came to Canada shortly before. And in doing so, many of the people in my own community come from around the world who have experienced persecution. I've spent a lot of my life learning how to navigate for other people. And I've seen firsthand how important it is and how difficult it is to exist in systems that are not always designed with newcomer experiences in mind, not with the mind of people who speak different languages, who have different abilities, and may not have the same social supports. So this guides a lot of the work that I do today. So again, I'm trying to make this as interactive as possible. So for folks, if you're interested, and maybe Priscilla can read out some of the answers, I wanted to ask, like, what does it even mean to be a newcomer? Who is a newcomer? And there's no right or wrong answers, but just some thoughts folks can share in the chat maybe about what does it even mean when we say the word newcomer? As a professor, I'm very patient at waiting for responses, so don't worry.
Our first response in the chat is new to the country.
New to the country.
0 to 5 years in Canada. Leaving behind family, friends, emotions, and things. Families who move to the country and are starting over.
These are some really good responses. And there's actually no one set definition, just like there's no one set definition of being a migrant or an immigrant. What it means typically is that person is in a different country of their birth. It doesn't tell us anything about why they came, how they came, and there's no clear answer for when does someone stop becoming an immigrant, stop becoming a newcomer? Is it after 2 years, like some agencies? Is it after 5 years with other agencies? Is it after 10 years? Is it after 20 years? There's no clear definition. And I wanted to share that because it's important that we remember that some of these terms that we use have not been designed by the people who are actually living with that term, but are applied to them by those of us on the outside. And there are many types of newcomers in Canada who exist under many different immigration statuses. And I just wanted to share just a smattering, because sometimes when we tend to lump everyone's experience into one tiny category, like immigrant or newcomer, we also lose those very different pathways that have come here that have shaped their stories. People can come as permanent residents, or economic immigrants, or coming with family reunification. People can come like my family did as government-assisted refugees. These are also what we call as resettled refugees, which means Canada has agreed before coming to that country to provide permanent residence to people who meet international law's definition of what it means to be a refugee. And you can see there are multiple different pathways to be a resettled refugee in this country. There are also people who are seeking refugee status, or what you may have heard the term refugee claimant or asylum seeker. These are individuals who come to Canada and, once arriving in Canada, seek asylum status, seek refugee status, and are in an interim designation until they're able to go before a court who can listen to their case and decide if it meets the definition of what it means to be a refugee in international law. We also have individuals who are temporary residents. These might be students who are here on student visas. These might be people who are here on work permits. These also might include visitors or tourists. And we also have people who live in our country without status. This may mean that they came as a different status holder initially, and now that status has expired and they have lost that status, but they still are residents and living here in Canada. And even just by me explaining all these different pathways, you can hear how their experiences might be so different, because we know immigration status is a determinant of health. We now know that in Canada is one of the world's leaders in the number of immigrants that it accepts annually. In 2023, it was about 500,000. And of those 500,000, almost 27% were children or young people under the age of 24. So right now, immigrants make up about 23% of the Canadian population, or between 2021 and 2023. And you can see that this number is expected to increase. So no matter what kind of project you're doing, you're going to be working with newcomers or interacting with newcomers in your projects. We know, as I said, there are many immigrant children in Canada. In the 2016 census, which in my mind still feels recent, but as I now appreciate was 8 years ago, that it was almost 40% of all Canadian children are either first generation, which the government says they were born outside of Canada, or second generation in that one of their parents was born outside of Canada. And this number was expected to almost reach 50% by the year 2050. So again, these are newcomers to Canada do not make up a small number of the population, and certainly not in the GTA where we work. But we know, and you will hear firsthand from people who have experienced this, is that we know that coming to Canada, even though we offer a land of opportunity and a better quality of life, is not without its challenges. Many families experience employment barriers and financial difficulties. There are a lot of barriers to having credentials accepted when people have trained outside of Canada. In Canada, most communication is done in English or French. And so for families who do not speak English or French, there can be language barriers in addition to literacy barriers. It's very isolating when you come by yourself. You may not always have social support. Even as something as simple as finding a community center or finding a park that your child can go to could be quite challenging, or registering in school. And navigating services is especially challenging. Navigating healthcare, education, often needing legal support if you're working on an immigration claim or work permits, all of those factors add to stressors. And we know on top of this, as I mentioned, that there's many different pathways with which families come to our country. And the health status of those families may depend on which way they are arriving in Canada and what they have been faced with before coming. For example, we know we have to think about infectious diseases in children and families who may have been living in unsafe circumstances in refugee camps or in areas of the world where there are higher levels of certain infections. Vaccines are often difficult for many families to access before coming to Canada. And again, if you're coming as an asylum seeker or you're coming as a refugee claimant, you may also need vaccines. Growth in nutrition is important as well, particularly in children, because access to food could have been difficult before you migrated or during your migration journey. And now coming to a new country where you may not be able to get the food that you know or the food that's familiar to you. And that can really affect a child's nutrition and growth. And lastly, we know that mental health and development is a huge area of concern for many adults as well as children when they come to Canada. It is difficult to move to a new place. You have lost a lot of the ties that you may have had to your home country. There may be things that are just unfamiliar to you, and that can lead to stressors. Certainly, if children have also experienced difficulties like conflict, particularly armed conflict or political instability, there are also traumatic experiences that can influence their development and health. And this is not just me saying it. This has also been something that's been discussed both in the literature and the media, that we know that they face chronic health risks, and we need to think about how we can actually help families. And we know, everyone here knows, that research can be so helpful on shedding light on what works best in terms of a program, what works best in terms of treatment, what are the gaps that we as clinicians and researchers need to be thinking about. But even though I told you how many newcomers exist in Canada, we know that they continue to be underrepresented in participants in research studies, especially ones that take place over time, like cohort and clinical trials. So why do you think that might be? Before I share some ideas, what are some ideas in the chat?
Our first response is language barriers.
Mm-hmm.
Fear is another. Lack of cultural sensitivity. Time and opportunity. These families may be already experiencing lots of pressures, may be hard to participate in repeated study visits. Not familiar with research, since back home could be perceived as being guinea pigs. Very new arrivals, often move frequently.
It's like you guys already knew what I was going to tell you. So if you think about, and keep throwing some answers in the chat, but if you think about the decision to participate in research like a health behavior, so no different than the decision to go to the doctor or the decision to go get cancer screening or the decision to choose one food or the other. So thinking about this from a health behavior ideology or a lens, there are perceived benefits or perceived not sufficient benefits. What is the value of my participation? There are many perceived barriers, like you said, the language and literacy, being recruited into a study, time, who's asking me, can I get there? And particularly around what are the norms around this? There's a lot of potential, there is potential for mistrust and suspicion. And this is building on the history of mistrust that many racialized communities who are also newcomers have with academic and research institutions. There is a fear around privacy, certainly if they're in precarious immigration status. What will this mean if I share my data with you? Who has access to my data? How might this be used against me? And there are also cultural considerations. The way someone might appreciate being spoken to or included differs across cultures. So in my lab, we actually said, we want to figure out facilitators. We know all the barriers, but let's try and ask the many families who come to the Compass Clinic, how can we make it better to include you in research? So we did a study where we spoke to 34 individuals, many of whom were newcomers representing 15 different countries, 14 different languages, someone from every single immigration status group that I shared with you. And this is what they told us. They said, every single one of them said, I would love to participate in projects that help my children and other children be healthier. But there are some key important points that matter to us. Who is doing the research matters to us. If it is someone I trust, or it is someone that I already have a good relationship with, that's going to help me. If it's been at an institution, one family told us, if I had a bad experience at that emergency department and I see a study is being done by an institution that is from that same institution, why would I help them? Because they see they see us as an extension of one institution. And it speaks to the idea of brokered trust, that also we spoke to settlement agencies, we spoke to case managers, and many said, if it was someone I trusted, even if it was my school teacher who told me about this project or my child's teacher, that would really influence my decision to participate. Where and when research is done matters. Many families who are newly arriving don't have the same familiarity with navigating from one place to another. We heard this from one family that said, I couldn't even, if you asked me to go somewhere, even going to the grocery store was difficult. So if you're asking me to go somewhere new as part of a research study, my answer would be no. But if it's somewhere I'm already going to, somewhere that I feel comfortable, then that will help me. What really matters is knowing how their contribution contributed to the work. And so getting the results of the project and how their role was included was very important to the families we talked to. They said it could be a flyer, but it would be so great if it was at a community event with food where you could share with us what you learned. And related to that, showing value for my participation in some capacity. It didn't always have to be money. Many families said that if this is a project for my child, for our children's health, give a toy or an opportunity for my child that they can participate in. In this project is also overseen by a parent advisory board. And one of the parents on our advisory board shared that with the funding from the compensation from our advisory board, they bought a bike for their son. And they shared that with all the advisory board members. And that was so important for them. It is important that we communicate directly the benefit of the project. There needs to be some benefit to their family or to help others, particularly for newcomer families. And sometimes I think we as researchers think it's clear, but when I've been very humbled in this project when talking to families, that what I think is clear and what families think is clear is very different. And what they're being asked to do matters. Certainly, families are comfortable with questionnaires and interviews, but some would let their children do a blood test or x-rays, but not all. And again, this is where who was doing the research and the trust really, really mattered. But what was very humbling for me was that when we talk to providers, we as providers think we know our families really well. This was humbling because sometimes it shows that we don't, in that we might be actually functioning as gatekeepers by perceiving that families do not want to participate, when it's not that they don't want to, it's that they had barriers to participation. Providers had different ideas of what was acceptable to patients and to participants if children were involved than what families said. And not all providers thought that compensation or showing value was essential, but we heard that from every single family. And we know that this is not homogenous. We know that the experiences of every person are different. We also know that many providers and researchers come from a place of protection. We don't want to cause harm. We want to make sure that we are doing everything we can to be protective. And so sometimes providers actually make that decision to not share a project with a family out of a place of protection. And we may not have the same appreciation for how the word research or project or study is translated into different languages and what the meaning of that word conjures up in one's mind. As a qualitative researcher, one way we would describe this is an emic understanding of a word versus an etic understanding. The emic understanding is the cultural significance of a word, that might actually also contribute to some mistrust. But don't take a disheartened approach to this, because what this shows us is that participatory methods, families where they can feel included, where they feel trusted, where they feel they trust who's happening, where they're able to actively participate in projects, that is something that we can do to help include newcomer families equitably in studies, even if your study is a trial. Participatory methods can be effectively integrated into a trial to enhance who is participating in your project and make your results even more meaningful and feasible, especially since we now know how many newcomers are going to be making up a part of the Canadian population. So this is a model of community-based participatory research by Nina Wallerstein. And you can see that what matters is the context, where, both structurally and socially, the partnership that you have, making sure that it's really based on relationships where there is trust and safety, that there's flexibility, the way you're integrating community knowledge and expertise, that the process is empowering, and that the output and the outcome actually are meaningful to who you're working with. And this helps lead to long-term transformation in community and address those health disparities that we're all working towards. I really like this slide from my colleague in Stanford that helps show how we can engage communities in research at different levels. And ultimately, where we all want to be in an ideal world is that the research is undertaken with community where members are equally part of the process. And this could be if you're working with newcomer families, that newcomer families are equally part of the research process. And it's okay if your research isn't there yet. You can see that there are many different levels to how engagement can happen. But it's important that we're honest with ourselves where our research is, and then think about how we can ultimately get to that point where families are able to be equitably included. So when I think about research using this lens, you can see it's quite cyclical. And this often takes time because it takes time to assess the community, assess like, what are the strengths? How are things working? What is the key question? What is the key, what are we working towards? Let's design the intervention together. And then let's think about how we're doing data collection, how we're doing dissemination. One project that you'll hear about later, which I'll get to, highlights all of this. And what this gets to is a motto that really guides a lot of the work that I do, that comes from disability justice advocates in South Africa, that says nothing about us without us is for us. And what that means is that if you are studying a population or you are trying to develop a program or an intervention for people, and the people who are affected are not part of the decision-making and the development, then that can actually be harmful and perpetuate more injustice. And this guides the work that our lab tries to do, often imperfectly, but what we are striving for. One way that you can have really good engagement throughout are community advisory boards. And how community advisory boards can contribute is by really helping inform whatever it is that you're creating, helping you understand the context of what it is you're trying to study or intervene, and also help you decide what should be a priority in that project, even in terms of outcomes. It's also very effective when you're thinking about disseminating findings and building trust with the communities that each of the members of your community advisory boards are part of. But having a community advisory board takes planning, work, time, and resources. So currently, I have 4 active community advisory boards. Sorry, I lied. 6 active community advisory boards for almost every project I work with. It means that the first part of my study is actually developing the community advisory board, thinking about who needs to be part of that group, making sure that everyone is able to feel that they understand what the purpose of the project is, and that we have created a place of safety where everyone can work together. Sometimes individuals you might know from, if you're a clinician, maybe you have really wonderful, trusting relationships, but maybe you don't. And this is where partnering with institutions or organizations beyond your academic center, with community partners who have deep relationships, again, with the communities they serve, that concept is called brokered trust, that they have trusted with the community, and by extension, that trust can come to you. This is a really great way to facilitate community engagement in your projects. When you're planning a CAB, you need to think about scheduling, logistics, timing. So often meetings sometimes will take place with the parents. We do a lot of meetings after hours when everyone's home from work. When I worked with youth, it would be right at 3:30, right when school ended, so they could, that's what they wanted in one setting, where I actually go into a school where I have a group of unaccompanied migrant youth who are advisors for a study in California. I go to the school and they want to meet right after 3:30, and they tell me what food to order every time. One time it was pizza, and the next time they're like, no, Shazeen, you're bringing tacos. So we had tacos. And I make sure that they all have a way to get there. That way which is around accessibility in terms of location, but also if you have people with disabilities, making sure that it's also accessible that way. Interpretation, because I mostly work with newcomers, I want to make sure everybody is comfortable communicating in the language of their preference. So sometimes that means translating documents into multiple languages. On one of our advisory boards, I think we have 7 languages represented. And so we will take the time that if we're putting together any materials, it gets translated into all of those languages. If that means we have to have group meetings with simultaneous translation or individual meetings so everyone can equally participate, so be it. We also want to think about childcare, food, and how we communicate with the group. Most people outside of academia don't use their email all the time. So one of the best ways we communicate are on WhatsApp groups, because that's what the community advisory board members want. And so when you're doing this in your study, you need to budget for this from the very beginning of your grant. And you also want to make sure that you're thinking about how you're compensating CAB members. When you're compensating, this is a challenge I know at many institutions because of restrictions with REBs and whether you can give cash, Visa gift cards, or regular gift cards. Do the best with what you can in your constraints. And the more that we're doing this kind of work, I think the more that we will see changes in our institutions who recognize this as important. For example, in one of the institutions that I worked with, they were requiring the social insurance number for tax purposes. I work with a lot of undocumented folks who don't have that. So that was one fundamental barrier to being able to include people. But by raising it, I'm now able to help them think through solutions so that we can better involve people. And what you want to prioritize with your CAB is it's not all work and no play. You want to make sure that you're prioritizing developing community, trust, and safety with your CAB members. And so this means that you are, what this means is you are contributing to making sure that some of what's happening is just building community, that you're actually building community with your family members. With the families that are there so that they're able, for example, to be fully present. Sorry, there was just a confusion with who was trying to get into my conference room that I'd booked, and so I got a little distracted. But what we're really speaking about is, for example, maybe holding a picnic with all of the family members so they can get together. Maybe making sure all the youth that are coming, that are part of your youth advisory board can also have other experiences. So with one of my youth advisory boards, it also meant bringing in other young people mentors to talk about their career paths and education and sharing other opportunities and providing opportunities to be involved in career development and mentorship. So I'm going to pass it over to Richa to tell you a little bit about what her perspective has been like as a co-researcher on a randomized controlled trial where we have co-designed a navigation program for migrant youth who have special healthcare needs. And we're very excited because our navigation program literally just started yesterday, but I'd love for you to hear from Richa now.
Thanks, Shazeen. Before I start, thanks for sharing all details. Now I think I have better understanding, all the effort and research that happened behind, right? That made us feel so comfortable and safe throughout the project. So yeah, thanks to you and your team for that. Just adding on and maybe starting to share a bit about myself, in addition to what Priscilla mentioned. So originally, I am from Kathmandu, Nepal, born and brought up in Kathmandu. Education wise, I have done my bachelor's in engineering with electronics and communication, and then I got married. I had my son, and then I was like, oh, something is missing. I need to do something. So then I did my master's in management with major in HR, and then I joined a commercial bank, was with the bank for about 10 years in human resources. Before me and my family, we made a very difficult decision to relocate to Canada with my family. So now it's been more than 5.5 years that we are here in Canada. My son, he is now 17. My daughter, she is 6. Um, my 17-year-old, he is under spectrum level 2, diagnosed to be with intellectual disability and ADHD. So we knew when we made a decision to relocate to Canada that, we'll be starting from almost zero, although we've got a lot of experience back home. And we were kind of prepared for that when we made that decision. After coming to Canada, we came as a permanent resident. So we had so many things that we had to do, right? From starting to take a decision, like where do we live, right? Looking for start earning. We've got 2 kids. So we had a back of the mind that, okay, one of us will be taking care of kids, one of us will be prioritizing those. We did have that in plan. It's not like we are not aware of it. But somewhere something that missed was like, what would especially my son go through, coming out of that safe environment from back home. And knowing where to start from. Like we had a tough time even finding a place to stay, right? We are staying in an Airbnb and we didn't know anyone in Canada. So wherever we went to find a place to live, it was like we needed a guarantor and, someone to take a guarantee or a job, which we didn't have at that time. So there were so many things on our plate and we were like working one by one. But at the same time, with my son, being away from all of the extended family members, new environment, a lot was going through with him. And we reached at a stage where I was like, I need help, right? Like he was going away from just home, running away, and I didn't know what to do. Family doctor, the wait line was so long that I just couldn't wait over there for hours for him to discuss with the doctor. So I didn't know where to start from, where to go. So I ended up in the emergency room at St. Mike Hospital. I was like, I need help. I don't know where to go, what to do. Um, and it was some wait out there, but I was like, I don't have an option, right? Like, I need to do something. And there, um, yeah, I met with the doctor out there, and then they advised me to connect with the campus clinic, like at St. Mike Pediatric Clinic. And they said that you'll get a call in some days, some weeks, few weeks. But I was like, okay, at least something, right? And here we are waiting eagerly for a call. And then one fine day, we get a call from Dr. Suleman's clinic. And then that's the way I connected with Dr. Suleman and team. That was the first place, I would say, after we came to Canada, where I was able to literally talk, right? And um, express everything that we had. It wasn't only about my son, but it was as a whole situation. And so looking back, I still feel like, oh, it was just yesterday, but it's been now more than 5 years, right? So um and from there, like the team, right? Dr. Suleman's team, they helped us with everything, navigating where to go, what to do, right? Obviously, we did our work, which we were already doing. Like I was looking for my first job, I just got my job, everything was happening. But there was a team, right, where with whom I could just reach out. Okay, this is happening. What do I do? My daughter's daycare. What do I do? Right? Somewhere I could just reach out. So when Dr. Suleman, she came that, okay, here we have a project, like, would you like to participate? I was like, more than happy, right? Now, when I think back, why? Because I think she and her team were able to create that safe environment for me and my family, right? And it's like, if I can do something for people who are at the same stage. I know, like Dr. Suman, just what you mentioned, so many new people, immigrants, right? And they come from different background. So I'm like, something we can do just for them to reach out, just to start, take that first step, that would mean a lot, right? So I was like, definitely, like I would love to do what I can from my end. And it starts from there, I think, where, because as a new immigrant we are so vulnerable at that stage, and you've mentioned in chat, we've got, it's different situation for everyone and so many things on our plate. So that way, when we know that we've got a team with whom we can have that trust, right? And I think the other would be a platform where we are able to express ourselves without being judged. Because that is something that holds ourselves back. We hold ourselves back because there's so many things. We are getting into a new culture. Even like while speaking, I think twice, oh, am I pronouncing it correctly? Uh, will it be taken in a different way? Like so many things goes in our mind. So uh, when we feel that, okay, this is a platform where I can just speak my mind out, right? So that is another important thing that helps me, that okay, I can just open up, share. Like there's no wrong thing. I know that if there is something, they'll let me know that, okay, this is it. So that's the trust, and bond that I share with Dr. Suleman and team. And and I think that's the reason that today I'm able to come to this platform and just be what I am, right? So I don't know, like I really don't have much of like, technical things, but it's more of sharing my experience, um, being part of this project where finally we've got, someone where we can reach out to, um, as first point of contact, right? So I don't know. Let me know if you want to add on anything, but that's what I have for you.
I have a question for you, Richa. Can you talk about what it's been like being part of the advisory board for the study, for the research project?
Personally, for me, it's been so satisfying, right? Like I think it's a couple of months that we worked on, and every um, meeting that we had, like before the meeting, I used to literally brainstorm as like, okay, what can I really share, right? Because it's not something theoretically that I need to do it. It's just sharing my experience based on my experience as like what would have helped me at that stage. So bringing it up and sharing it with you and the team members. And I love the way where you and your team gave us as a parent the platform just to speak, right? Like listen, it wasn't one way that, okay, this is what we are doing. It was more of exploring, finding out, and with open mind. Like there wasn't any decision. It was like, okay, what can be done? And then we, brainstormed, and slowly we're like, okay, maybe having someone, that point of contact where everyone could reach out and do this. Okay, what kind of person is needed? So that way we brainstormed, and everyone together, you all listened to us, our experience, and then the way it came up. So I think that was really very fulfilling for me to be able to express and to see how those were taken into consideration, and then we came up to, yeah, what we have today. So that was very fulfilling.
Richa is being very humble because she also helped design the whole intervention in terms of what competencies the navigator should have, what the job description could be, and her experience in HR was so helpful because she actually interviewed the our navigator, who is now joining us today, but is our intervention. So she played a huge role. And I just wanted to highlight that because I know Richa is being very modest.
Well, I think the question like is starting, like I said, it's giving us that platform, right? Giving, trusting us that, here you go, like being open to listen to us. That is important. That's the starting point, because I feel everyone has got their own expertise, but it's when you are in that position, you being open to that. So yeah, I think it's like I said, um on your part, like you, I really appreciate, you and your team, like design. And today, when you shared that, I see where it comes from, right? It wasn't something that happened just immediately. You did so much research on that, understanding what we are going through that. And based on that, you brought it up, like be it creating that WhatsApp group or compensating, everything was part of it. And you all thought, went through that thought process of what we go through, what we are going through, understanding our needs. And then you created the project in such a way that we felt, safe in that. So yeah, I think starting was, on your end. So
Well, I just want to put out there that I did not tell Richa to say anything. But it just, I think, highlights just how joyful this kind of work really is for me, and how just some of the, just as we kind of go over to questions now, I think Richa really highlighted so much of what we've learned as researchers, like as when I say we, I mean my team and my co-researchers. It's a little bit different from how we do a traditional project where you let go of a lot of control and you come in with an open mind, with humility, with flexibility, and you see what unfolds. And when you do that, you actually develop really impactful, powerful interventions. And everything that we create is co-owned. It's not just that I hold it. Everything we create is shared back with the parents, the job descriptions, the study design, being really thoughtful around compensation. And again, Richa has also been extremely helpful with translation. So as an example, when we started this study, we said, we'll do translations, at least in the top 5 languages at our sites, not recognizing that at all our sites, the top 5 languages would be different. So our parent advisory board has said, no problem, I can help you with translation with so many different languages. And that has also really enhanced our study. So as we turn over to you for questions, we just wanted to share, I hope this has provided with a little bit of a takeaway that it's important that we think about how to integrate immigrant and newcomer families into our studies. And we know what barriers are there. Now there are lots of steps that we can take to better include families in studies, including using participatory methods in traditional design. And community advisory boards can be really effective, but when, again, you're trying to make an advisory board inclusive from the get-go, it does require a lot of intentional planning. That doesn't mean it can't be done. It just means you've got to think through it for all of those pieces at the beginning. And I just wanted to thank the 2 parent advisory board members who have been really impactful. One for the study I shared about the barriers and facilitators, who call themselves the Super Science Squad. That was their name. They have their own logo. And Richa is part of the Parent Change Makers, which was also the name that was created by the Parent Advisory Board. And a big thanks to the Compass Lab team, RB, who is on the call today, Catherine, who is our new coordinator, or new navigator. So we're so excited for her, as well as some of the students and our lab managers. So if you're interested in our work or want to work together, please visit our website, and you're welcome to email me anytime, and I'll stop sharing so we can see more of your faces, and we'd love to have any questions or comments.
Thank you so much, Shazeen and Richa. As I mentioned from the start, have been looking forward to this presentation since we set the date, and you exceeded all expectations, might I add. I was feverishly writing down notes of things to follow up with you individually about processes and also potential questions that I could pose to strike up conversation during Q&A. So this is the time in which, if anyone has any questions for our speakers, please feel free to raise your virtual hand. You're also welcome to leave your questions in the chat for the speakers, and I'll make sure to bring them to their attention. But perhaps I could get things started as folks are thinking through potential questions they'd like to pose themselves about the work they're involved with. And it's actually for both of you. Based on your experiences, are there or have there been unexpected outcomes or lessons learned from your experiences involved within the research process? You identified some of them towards the tail end of your talk, but I really wanted to give you the floor to elaborate a little bit further.
Richa, would you like me to go first, or would you like to go first?
Yeah, you can start, and I'll take it from there.
I think it's I think partly it a bit depends on your personality. I was sharing with a colleague yesterday who said, wow, you're someone who most people see problems, and I'm like, ooh, opportunity. So I really just love problem solving and doing puzzles. And that's I think what draws me to this kind of work. And one example of something that surprised me came from a project with youth, where we were looking at developing a toolkit or some kind of tool or resource to help asylum-seeking youth navigate the Ontario healthcare system. And I totally was like, they're going to say an app, it needs to be on Instagram or TikTok. And it was the opposite. The youth were like, absolutely not. They said, we want a resource that we can screenshot and keep on our phone, but I need it to be one place where I can get everything, like a website or a document. And the other thing that I was so humbled by is, as we were working with a graphic designer, the youth were like, please don't use that font. That's not disability friendly. And again, they said, don't use those colors. That's not helpful for people who can't see. So what I'm trying to share is these are small things that if I had been the one to create an intervention all by myself with all the literature and all my educational training, it would never look like what is actually implemented in our studies when you have the input of people who are experiencing what you're trying to address in real life. There is something that cannot be erased from that, and it makes your intervention so much better. So every single time I do one of these things, I always love looking back on what I thought was going to happen and what's actually happened. I don't know if Richa, you wanted to add anything.
I don't know if it makes sense, but for me, from the project, frankly, like when we started, right? We were working on it, but I could never, like, it wasn't there that we could have really hired someone and here just like that wasn't in my mind, right? Like we're like, okay, we'll do something, more of paperwork. Okay, this is the way we'll do it, maybe questionnaire here and there. But it felt so good, like when we reached that, okay, we'll be hiring an interview process, and it's like, wow, we're like, we have it, like, we did it. So I I just love the way it translated into something, and here we have, right? Something that now which we know will make a lot of impact, right? And even when once we've hired, like when we last connected, you said, okay, how do we let people know that she's there? Like that, we have someone. And the way you listen to, you're like, okay, yeah, we can do this, community places, schools, doctors. So it feels just so amazing, right? Like didn't have it in my mind initially that we'll be able to do it, but yeah, feels just amazing uh reaching over here. So that's what comes to my mind.
Perfect. Are there any questions from those on the call for our speakers today? Again, please feel free to raise your virtual hand, or please feel free to write your question in the chat. I'll keep an eye on it. Go ahead.
Hi, I'm Nasheed, and I am a student at University of Alberta, and I'm studying community engagement program right now. So my question is like, as I'm doing the like similar type of study for my thesis, and I was wondering like for the CBR project, what we do is like we get back to the community with the results we got from the project, but sometimes what we do is like use the results that we find from the project and advocating the policymakers to change the policies. So is that like, can you please share your experience if you have any like engaging the parents into the policymaking process to see like what they have come across, what they've faced after migrating to this new country, and like how their experiences, their real life experiences are now changing the policy for them. Like they will feel more, proud for them, like they did something for their community. So if there's any experience like what you had, I would love to hear that. Thank you.
What a great question. And I love that you're doing this work already. And I think it's so important when we think about that, when we want to make intervention sustainable, that it is integrated into policy. Now, policy doesn't always have to mean in the House, in Parliament, on Parliament Hill. Policy can be institutional policy. Policy can be at a community level, a municipal level, a provincial level. And so a couple of things is, one, on the grants, when we're putting grants together, we actually had our institutional policy lead, so someone who's responsible for all policies in our hospital, be part of this initial grant submission. They're one of the co-collaborators on this grant. So when we have big meetings that parents as well as collaborators are invited to, they're hearing directly what the parents are saying and how important the findings from the study are. I also think that when we are doing research, a way we can frame it is make sure our question is able to be translated into policy somehow. So thinking about your research as policy engaged, right? So is this going to inform how my hospital or my clinic or my organization does interpretation, interacts with this client population? Is this going to be something that can make this intervention now embedded into the community? Those are all ways to integrate policy into your work. In some of my other projects, I actually have multiple stakeholder boards. So for the study, I'm working with migrant youth, for example, who are developing an intervention to help them access primary care better. These are all unaccompanied. The youth have their own working board, and then they come and present to a stakeholder board that includes policymakers at the local level to hear directly what the youth are saying so that that can inform whatever they're doing. And so I think what your role is to think about that right at the beginning, like you're doing, and say, where are the ways in which I can now can support that connection so that what the families are sharing can actually be heard and actualized, right? And so sometimes you have that capacity yourself as a researcher or clinician because you might have some influence over how some policies and procedures are at your organization. But if you don't, bring those people into your project, right? Because people will feel more likely to actually enact what they hear when they're part of it. I hope that answers your question. Okay.
Absolutely perfect. Yeah. Thank you.
You're very welcome.
Great. I am cognizant of time. There's only a minute left of the session. So I'd like to thank our speakers for joining us today, discussing their incredible work, experience, and lens on research. I certainly look forward to everyone on the call joining our next series event, so please stay tuned for those details. If you're interested in continuing the conversation with Shazeen, again, please feel free to reach out to her directly via email. I will follow up after today's call with that information to those who attended today. So thank you very much and have yourselves a wonderful rest of the day.
Thank you.